So, this is our second Holistic Health Anonymous, and the topic today is diet. So, how has diet impacted health and wellness? I know my husband and we've shared our story. I've shared multiple stories with the kiddos. So, we have a couple of listeners who want to share their story with how their diet positively and drastically impacted their lives, and not only their lives, but their families' lives, their motivation, their functioning. So let's dig in and hear their side of the story.
You ready?
Yeah.
Okay, well, thank you for having me on today. So, my name is Hagen, and 10 years ago, I had my second and final baby. And right after I had him, things were just different. So, every day I woke up and I felt very foggy. I felt very sore. I had this shortness of breath to me, even like just going up the stairs and doing just routine tasks. I just had a lack of motivation and sinus issues all the time. I was grouchy. And every night, I think I said the same thing at the same time, which is my stomach hurts. And my husband said, "Do you say that every night at almost this exact same time?" It just mostly after eating, a few hours after eating. And I just had low energy, and I kept thinking, like, this is just, new mom. Like, I had another baby a year and a month before that. So I was just really trying to blame it on something. And at that time, my son was having a lot of reflux, and I went and talked to lactation, and they said, well, sometimes dairy can help with the reflux from the mom. How about you take out dairy? So I did that, and at that time I was eating the standard American diet. So a lot of bread, a lot of milk, a lot of cheese, yogurt, things that, like, on the food pyramid looked good, 6 to 8 servings of grains and dairy and, a little bit of fruits and vegetables sprinkled in, but no real idea about what whole foods were. So I thought, well, I'll take this into consideration because his reflux was so bad and I didn't want to see him, miserable. So after about a week of dairy free, I thought, oh my gosh, my stomach is this what normal feels like? So after 2 weeks of being dairy free, I had no stomach issues. I thought, well, this is it. Like, maybe this is causing my problems. But unfortunately, everything else was still there. Still had the brain fog, still had the exhausted, low energy. I still had acne, just overall sore. And I thought, there's got to be something different. And in that time frame, my sister had called me. She was actually going through the exact same thing, and she said, "I'm going to try gluten-free." And I thought, there is no way. I don't even know what that means. At that time, we didn't have as much social media as we have now, and like TED Talks and awareness. And I didn't even know what a functional medicine doctor was. And I wasn't understanding how diet would impact my lifestyle. But I had a suspicion because I knew what the dairy-free felt like. Right. So it took me probably 6 to 9 months to really, truly understand what is gluten-free and what is gluten and how can I make my life gluten-free. So I started with gluten-free products. So gluten-free muffins, gluten-free bread, gluten-free pasta. And did I feel better? Absolutely. It took, that 6 to 9 months of transitioning to understand, wow, things are really starting to change. My acne was starting to get more clear. I wasn't sick as frequently. I could lift my babies and do things and not feel exhausted. And I was sleeping deeper than I was before. I was starting to become more motivated. I started to have some more life in me. So I did that for about 2 or 3 years where I was using a lot of gluten-free products. And then when my kids started to go to preschool, when I had a little bit more time, everyone needs time, right? When I had a little bit more time, I started to explore just this life of what's naturally gluten-free. What's a whole food diet look like where I'm not buying all these gluten-free labeled things? What does a life of naturally gluten-free look like? And I went through the Whole30 program several times to really identify what other areas are, is my problem. And really, grains I have found are just not good for me. So the gluten-free label things, they were great for going gluten-free, but now how can I maintain a more healthy lifestyle where all symptoms are gone? So when they went to preschool, I started digging into that. I dropped them off at preschool. I go straight to the grocery store. I would get what I could, go home, cook something fast and furious. And I realized, wow, like this is another turning point. So after a few rounds of Whole30, I eventually also found out that beans and peanuts are not my friend either. So I've eliminated those. And, not to say that like I'm never going to have a peanut butter cookie that's gluten free. Like I will take a bite of that for sure. And not that I say I'll never eat something with beans in it, but my lifestyle is not centered around, those two food groups along with dairy and gluten. So then when my son went to kindergarten, I said, I feel so full of life. I went back to teaching. I got my master's. I'm coaching two sports of my daughter. I can feel like I literally can conquer anything. I am just happy and full of life and joy. And I know that, well, part of it I know is my faith, right? We know that we all here because we have the joy of something else. It's not always earthly things, but that diet has a huge part of my earthly joy. So
Absolutely. I love that. And I love how you kind of went through that journey of, good, better with gluten-free processed food, but now you're living your best life truly with enjoying and being present for your kids.
mm-hmm.
Yeah.
Absolutely. Yeah. And, it's not easy. And I think that sometimes, when I heard the words, I got a gluten free, that sounded very hard. And then when I thought to myself, if I've done that, I can make this jump to real food. And, it's been the best thing that I've ever done for me and my family. So my family's been gluten free for 7 years. And it's just like something that comes natural to all of us. My son had a really bad bout of eczema right before that preschool that was just like staining his skin. And after gluten free, it's never ever came back. My daughter's belly was so distended, we had to do ultrasounds. The doctor thought there was something in there. It was really scary. And she was backed up so far in her bowels. And ever since she's been gluten free, she's just grown and changed. And it's made a difference for all of us.
Yeah, absolutely. And I love it that it's a lifestyle.
Mm-hmm. It
Yeah, it
is.
always breaks my heart when they throw medications, especially, medications at kids
Yeah.
instead of treating the root of the issue.
Yeah.
Yeah,
And
absolutely.
a lot of people will say like, well, how do I know if I should go gluten free? And honestly, my true advice is to just do an elimination diet, because you will know you do not need to go through all the things and the testing and the endoscopies. You can absolutely, if that is what you need to
Sure.
do. But I'm telling you, an elimination diet of 21 to 30 days of no gluten, if you see any changes, like that is the red flag. If you see some things that are gone that you used to deal with.
Exactly. And I feel like there's better compliance when you kind of initiate that yourself and stick with it versus if you have a test and you're told what you can't eat versus what's allowed. I just feel like people do better choosing to do that elimination diet and then
Mm-hmm.
making the lifestyle transitions.
Yeah, absolutely.
Yep. Did you find it hard? I feel like the other challenge is society kind of tells us, since it's so fast paced, you don't have time to cook or eat at home. So let's do packaged food, let's do processed food. After that initial hurdle, did you find it's actually easier to cook from scratch?
I did. And like people always say, like, send me your best gluten-free recipes. And it's like, I just tell them a protein and a fruit and vegetable. Like that is every meal. Like we eat a protein and a roasted vegetable. Like it doesn't have to be a recipe. And I think that's what sounds intimidating. Like, and then, the transition from just grocery store meat to sourcing, knowing a local farmer and getting a good source. Like there are so many jumps in this whole food diet that like I have made over the years. And that's why it's not a quick fix. Like I'm 10 years in, I'm finally finding, a grass-fed farmer or a local, vegetables that are grown near me, or, you can do what you can. So people say they don't have time, like I'm okay with going to Walmart and getting my veggies if I have to in the middle of winter. Like you just do what you can do to
Right.
get protein and fiber and whole foods on the table, and you're going to be better off in the packaged foods.
Absolutely. Yeah, it was funny. Last week I had a patient because I'm transitioning her to a whole foods diet, and she's noticed an improvement in a month, but she's like, Dr. Heather, I need a plan. Like, I need to know how many calories I can eat, how many macros. And I'm like, that's society telling you you need that. Like, we don't need that. It's just kind of common sense. But I did suggest the Whole 30 because that's a great, if you need like structure, that's a
Hmm.
great place to start.
Yeah, I love their PDF of the plate that shows like thumb of fat, fist of protein, the rest veggies, and some fruit, obviously, or nuts and seeds in that thumb. But like that was a really good visual for me, and I try to share that with others too.
Yeah, it's just easy to wrap your head around.
And rules around food, people don't like rules around food. So I try to start it out to say, know this, know that. Just like our kids don't say like, don't jump off the chair. They're gonna jump off the chair. Right? So we're trying to say the yes things. Like here's all the things you can eat. Like, and I think Whole 30, I think Melissa's kind of changed her thoughts too on like snacking. Like she used to be like no snacks, but now she's like, if it's going in your mouth and it's Whole 30, like fuel your body with it.
Exactly. Listen to your gut.
Mm-hmm. Mm-hmm.
Awesome. Well, thank you so much for taking the time to share.
Yes, yeah, and I can't thank you enough. Like you really helped me in the very beginning of this whole journey, and just was mentioning foods here and there about how food relates to how you feel. And I didn't know what that meant. Now internalizing those thoughts, I do, but you planted the seed, you really did. So I really appreciate it.
Oh,
And you really helped fix my sciatica years ago, but I know that part of that was inflammation. And like the one time I have been glutened, I can't believe this. 5 years ago, I ate a gluten-free cupcake at a party that was mislabeled. My sciatica came back. I woke up the next day and I was sore. And it's like, I'm just inflamed.
yeah.
Like it was so crazy. Like I had this neck injury from college basketball too. Like both of those things that after I got gluten, I'm like, wow, that's yeah.
Yeah, inflammation will settle in your weak spots. Absolutely. Yeah, and it's
Mm-hmm.
not, and you've known this, it's not your body turning on you, it's what you're fueling or not fueling your body with that's making it symptomatic.
Absolutely.
Yeah. How long did it take for that inflammation to get out of your system?
Oh my gosh, like a month. It was bad.
Yeah.
Yeah. And that time I was transitioning from the gluten-free to whole foods. That's why I was eating a cupcake. But um I think that probably had something to do with it. I know now, like if I'm really sick or I'm preparing for like a procedure or something, that I am just really whole foods because I know that I'm going to recover better.
Absolutely.
Exactly. Yeah.
All right. Well, welcome. Thank you for coming on the show.
Of course.
And of course, we're talking about how diet has influenced health and wellness. And go ahead and start sharing your journey with us.
Yeah, so my name is Holly. I am 22. I am a medical student. And essentially, I was diagnosed about a year ago with a sensitivity to gluten. So I've been gluten-free for 1 year. And I am so much happier and healthier because of it. But essentially, I've always, as far as I can remember, I've always had like IBS or IBD, which, as we know, it's kind of a broad general term. So I've always had GI symptoms, but nothing was ever diagnosed. And essentially, then in high school, I became lactose intolerant. And I had a lot of lab tests done at that point. So I had like a full lab panel, but nothing abnormal was ever shown. And I always ate fairly healthy, but I never like excluded anything from my diet. And my junior year of college, I started to become pretty sick. I was getting sick a lot in general, so colds, influenza, COVID, sinus problems. But on top of all of that, I started to experience really bad migraines. And this was something I never really had an issue with before. Kind of runs in my family a little bit, like my mom used to get them, but besides that, there was no reason why I should have had migraines. Besides maybe stress, right? Obviously, in college, um, you go through a lot and you're looking at your computer a lot and studying. So I thought maybe that could be the reason why. However, my migraines only got worse. Um, and at this point, they were affecting my everyday life pretty severely. And I was in school though, and I didn't have time to go to a doctor or talk with anyone about it in depth. And so I got some migraine medication and I kept on going. Um, but I did have other symptoms as well. And at the time, it's funny because I didn't even know they were symptoms. Um, but now I know they definitely were. And we'll get into that later a little bit with when I took gluten out of my diet and I saw all of those symptoms that gluten was causing me. And just to know, along with my migraines, I had an incredibly sore neck. And I found that my neck would get very inflamed and stiff. And I know now that, gluten can cause joint pain and inflammation. And I was definitely experiencing that. It was not just me looking down at my laptop. I continued to have GI symptoms, but that was not really anything new to me. I just, again, thought I had IBS. And going into the summer, I only noticed it getting worse. And that was weird because I did think maybe it was from studying or stress or all of those things. So, a week after a vacation in the summer, which I ate a ton of bread and carbs, a ton of them, I became very, very sick. I had tons of GI symptoms and other symptoms, and I felt horrible. Uh, and I'm going to kind of go through GI symptoms that you can get. I'm not going to confirm the symptoms that I had, because that's a little personal. But I am going to go through a list of symptoms that you can get, just for listeners to know what to maybe look out for. So one of the main things that you think about with a gluten sensitivity is bloating. Bloating can range. It can be pretty severe. It can be on and off, but bloating. Another one is gas. And along with gas comes, stool movement, so stuff like diarrhea. And I want to further note that with gluten, you can get malabsorption. So malabsorption can then lead to stool containing abnormally high levels of fat. So this can be referred to as steatorrhea. That's like the medical term, but essentially it can make your stool be like very foul smelling. It almost can look greasy or yellowish orange, or oily is another word that can be used for having fat in the stool, which comes from that malabsorption. So yeah, and then abdominal pain, nausea, vomiting, those are other GI symptoms that you can see as well. So at this point, I genuinely could not keep anything in me. I was so sick. And I remember eating soup at one point after I started feeling a little better. And it was chicken noodle soup. And I got very sick after that. And I was like, well, there's not a lot in this right now, except for like the noodles.
Sure.
So that was a big red flag for me. And at this point, I considered obviously talking with my aunt. And before that, I did get labs done again. And because I was adamant something was wrong. I didn't know what, but I knew that as a healthy young girl, I should not be having all of these symptoms and problems. I just shouldn't. And that brings me to a point of it is very important to advocate for yourself. Um, you know, you have to advocate until you find either someone that can help you out or until you get the help that you need because it's never normal to feel sick and yeah, so I just want to say that that's very important. Now my labs, everything was overall fine. There was one thing that kind of stood out to me, and it was that my alkaline phosphatase was low. Now, of course, what do? You go to Google. And so I went to Google and I was looking things up, and I found out that low levels of ALP could be a sign of malabsorption. So we're back to this malabsorption point. So what is it malabsorption of? Well, it's malabsorption of nutrients or proteins. And this can be with some people, celiac disease. That's a whole different end of the spectrum. But essentially, alkaline phosphatase, it plays a role in maintaining the gut barrier. And for example, it protects against leaky gut syndrome. So that's a whole another point. But as I said, celiac, it's a whole different thing. It's a very serious disease. And at that point in time, though, it was my closest assumption because I didn't know about gluten sensitivities. And I didn't know there was such a wide range and a whole spectrum of diagnoses that you can get. You can be sensitive to gluten, you can be allergic to gluten, you can have an intolerance, or you can have celiac. And even within that, even if you're sensitive to gluten, you could have just some joint pain from it, or you can feel very, very sick from it.
Yeah.
And regardless, however you're feeling, it's obviously important and it's something that you might want to cut out. So at this point, what did I do? I went to my aunt, my Aunt Heather, and I was desperate. I was like, please help me. I think it's gluten, but I don't know what it is. And she ultimately did the ALCAT test on me. And I'll let you speak for a bit kind of about what the ALCAT test is, because I think it's obviously it measures for food sensitivities, but
yeah, like you said, there's so many different levels of sensitivities or intolerances. So the ALCAT's really cool. They've been around for over 10 years. With the ALCAT, it's a simple blood test, and it checks for casein, gluten, gliadin, like the proteins in dairy, and gluten, and then also checks for candida. It checks for over 150 foods, but it can check up to 300 depending on what panel you run. And the cool thing they've come out lately is you can check for, especially for kiddos, like food dyes, additives, artificial sweeteners, herbs. Some supplements are covered, fungus, mold, things like that. So for you, I remember we just kind of did the basic because we figured it was gluten, but we just needed confirmation of what other triggers there might be. The only challenge, because this is considered like a functional test, it's not covered by insurance.
Yes.
Unless, you check for celiac, which is an autoimmune, and that is covered by insurance. So that's the only, I want to say, caveat with ALCAT. But it's a really simple test.
Yeah. And thank goodness I did it. So the food sensitivities test report came back, and it found that I had a moderate reaction to gluten and a severe reaction to gliadin. So what is gliadin? That was my first thought. I was like,
right.
What is this?
Gliadin. You don't hear about it.
No, you don't hear about it. You only ever hear about gluten, not gliadin. And well, gliadin is a component of the wheat protein gluten. So it's in there as well, causing you pain and discomfort sometimes. And it kind of what it does is it triggers a T cell mediated immune response in genetically susceptible individuals. And that can cause celiac disease. But gluten and gliadin are the protein fractions of the most common grains. So wheat, rye, barley, malt, all of those things, they're in them. So that leads me to my next thing. Once I found this information out, I started my gluten-free journey. And let me tell you, gluten is in everything. Literally everything.
Even
condiments. I had no idea. No idea. Yep. I just thought, oh yeah, I'll cut out bread and pastas and that stuff. Well, it took me doing a lot of research to kind of figure out everything that you had to avoid. Because wheat is the most common gluten containing grain, it obviously has a lot of properties that you want, like thickening and getting things fluffy. So it's used in like sauces, soups, beverages. You can have it in medication, supplements, topicals, and even oats need to specifically be gluten-free.
Yep.
I had no idea. So I started doing some research into all of this, and after a few weeks, I noticed a huge difference in how I felt. And it was really hard kind of figuring out what I could and couldn't eat. So in these first few months, I remember I would get glutened occasionally. So going into this glutening, it allowed me to start to identify my symptoms better. So I had said earlier that there were a lot of symptoms I was having, but I didn't know that they were correlated to gluten specifically for me. I just felt so horrible that I didn't even know what was gluten and what wasn't. So I'm going to go through some symptoms of mine that were odd and kind of weird, but I determined that they were definitely gluten related. So starting off, joint pain. I had bad joint pain, and joints get swollen, they get inflamed. I do think this is a more common one. A lot of people find when they do cut out gluten that their joints feel better, and that's wonderful because everybody doesn't want joint pain, obviously, and feels
Especially
better
at your
when.
age.
Yeah, especially at my age. I'm like, I'm too young for this. Um, so joint pain. Another one was very intense brain fog. I never had brain fog before. And it was really hard for me to explain, especially to people, because how do you explain brain fog? I just felt very like I was in slow motion. Honestly, I know I looked it up online to kind of try to give an explanation of how it felt, almost like you were trapped in quicksand or, you're slowly turning to stone. I just had confusion, lack of focus and mental clarity. And brain fog is a huge one for me that I get. That I'm so thankful I don't get anymore. And along with brain fog is extreme fatigue. When I get glutened, I genuinely feel like I could sleep a whole entire day and then still be tired and then still not be able to like stay awake. And obviously, when you're a student and working, you don't have time to feel like that. You have to go on with your everyday life, and it just feels like you're walking around as a zombie. And that's not good, not how you want to feel when overall you're a healthy, healthy young adult. At the same time, though, even though I was having that extreme fatigue, I would sometimes get insomnia at night. And the reason was because of something it's referred to as like restless leg syndrome, essentially. I noticed that the nerves in my legs had just like this unpleasant sensation that made me feel like I had to move them or get up and walk. And I've done research since, and that can be related to gluten. Who'd have thought? Not me. But yeah, so it's all of these different things that you just wouldn't think about. And also I'll note like mouth ulcers, so like canker sores, things like that inside the mouth. That was something that I realized I got as well. And I just want to reiterate the migraines and the neck pain. The muscles can get very stiff and inflamed with it, and that was a huge symptom for me. So the reason why I go through all these and note them is because I really do want people to know if you are having any of these symptoms, maybe it would be beneficial to think about taking gluten out of your diet for a while and seeing how you feel. So yeah, I am happily 1 year gluten-free. I'm so much healthier and happier and energetic. I feel like I got my life back in a way. And I will say that the food does start to taste better. I promise your taste buds will adapt. I remember when I first went gluten free, I was like, oh no, like this stuff does not taste how normal food would taste. But your taste buds will adapt, and I don't even notice it anymore. My family jokes with me sometimes with some of the products. They're like, "This tastes, different," and I'm like, "Really? I don't think so." Um, but and anymore with being gluten sensitive or intolerant or whatever, there's so many options on the market,
Yeah, it's come such a
and
long.
it's come a very long way. And that's another thing. If I had this 10 years ago, it would definitely probably be harder. But I didn't think it was, once I knew, what had gluten in it, it was fairly easy to find alternatives for those things. Uh, but yeah, I mean, I often say how going gluten-free changed my life, and people definitely probably think I'm exaggerating. But it truly did. And I do want to say that also my aunt and I decided to cut out food dyes and artificial sweeteners. And that definitely also contributed to a decrease in my migraines. And I think that is important. That was something that I had always eaten food dyes and artificial sweeteners and all those things. I just never thought about it. But I will notice, apart from the gluten, I'm obviously very gluten free now. But if I will have a candy with food dye in it or something with artificial sweeteners, that is a trigger for my migraines as well, personally. Um, and also something I want to note, because I noted it in the beginning, my lactose intolerance. Essentially, since stopping gluten, I do feel like my gut has healed. Um, and in that way, I find that I'm a little less intolerant to lactose.
Oh,
And I
that's
feel like I can eat lactose and all the things better now than what I could in the past. Um, so, yeah, that's my story.
good. Oh my gosh. Well, thank you so much for sharing. Yeah, it's crazy, identifying that primary trigger for malabsorption um,
Mhm.
allowed for the dairy to kind of come on its own. And yeah, there's definitely benefits to dairy. So it's nice that you can dabble in that a little bit more.
Definitely. There's benefits to dairy, and that's another thing as well. Obviously, um, I think a lot of people can kind of go on, they start taking things out of their diet, but it is important to note that if there's a reason to take it out of your diet, yes, it's very important then. But there are benefits to having things like dairy or different things. They have nutritional benefits as well,
For sure. For sure.
if you can eat them.
Yeah.
But
Yeah. 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 And then it's funny that you noted that your taste buds do change, right? I mean, you get
uh,
used to it, you kind of get in routine. And then when you do have an exposure or something like that, you're like, oh, it's not worth it.
yeah, no, it's definitely not worth it. Yeah, it's sometimes I get asked like, oh, like, don't you just want to take a bite or try it? And it's tempting, but I know what will follow
Oh,
if I
yeah,
do. And it's definitely severe enough for me to not want to take that chance at all.
exactly.
For sure. Yeah. Uh, and then I guess just a disclaimer as well, because I do get this question from some people. People wonder why I didn't test for celiac when I first found out that gluten was affecting me, how it was. And I want to say that at the time, it wasn't on my radar because nobody in my family has celiac. So I didn't even think about it. I had an ANA test for autoimmune, and it was negative. And at the time, obviously, celiac, it's immune mediated, autoimmune mediated. However, just because you do have like a negative ANA, it doesn't necessarily mean that you don't have celiac disease. But in order to get tested for celiac, you do have to be eating gluten. And at this point, I'd have to eat it for like up to 8 weeks to get that test. And I couldn't do it. I just couldn't. But it is, something that I want to note that if you really do think that you could potentially be celiac, maybe you do want to get that test before you cut out gluten. Um, but yeah,
Yeah.
that's just a side note, a disclaimer.
Absolutely. I have a lot of patients who've done that, who have cut it out and they feel so much better. They're like, well, even if it would be positive, like I'm not going to go and eat gluten to find
Yeah,
out. Like it's just better
exactly.
to not eat gluten. So
Exactly. And it's a long process to get that diagnosis of really being celiac. It can take multiple positive tests um, and endoscopies. So personally, it would have, been a lot to get that. And with being in school, I just didn't have the time to do so. Uh, but yeah, I wanted to note that as well.
well, thank you so much for taking the time and sharing your story and how
Yes.
your diet changes have drastically really improved your life and how you're functioning.
Yes, of course. Thank you for having me. And I was excited to share all of that. And I hope that, if any listeners uh, do cut it out and notice a difference, then that's awesome. But yeah.
So, for our third Holistic Health Anonymous, we are going to kind of dive into the topic of gut feelings. We know the gut is the second brain, but how many times have you had a gut feeling that something's wrong? You've seen doctors, you've kind of done your own research, and you're still not getting those answers. Was there an instance where you've had that gut feeling and you sought out resolution on your own? That could be with a condition, symptoms. It could be for example, if you noticed a correlation with your kids with diet or vaccines or anything like that. So especially us as mothers, we always have that gut feeling. And as women, I feel like sometimes we often get dismissed that it's in our head or it's hormones or whatnot. So give me some examples and please share your stories if you've had a gut feeling that wasn't being addressed, but you were persistent and you made those connections on yourself.